Welcome, Cynthia. Perfect. Thank you all for being here. Welcome, everyone. My name is Roni, and I am the Child and Family Program Manager for the Mental Health Association of Maryland. I want to welcome you all to the first session of the Healthy New Moms webinar series. This is the first of many webinars in this series, and we are so glad to have you all join us on this journey with Healthy New Moms. So Healthy New Moms is a program of the Mental Health Association of Maryland with support from the Maryland Department of Health's Behavioral Health Administration. Healthy New Mom works to raise awareness of perinatal mood and anxiety disorders and offers support and resources to moms and to families and to providers across the state. You can learn more about Healthy New Moms by visiting mhamd.org. And so now I'll jump into talking about today's session. Today is going to be recorded and will be made available to you in the coming week. So our speaker, Nicole Kumi, will provide an overview of perinatal mood and anxiety disorders, and this will include exploring common myths and facts, how these disorders can impact a mother's well-being and her surrounding community, and practical steps to begin or propel your journey toward recovery. Whether you're a new or expecting mother, a family member or relative, or a service provider, this is going to provide practical tools and valuable insights to help you take informed steps towards well-being, as well as fostering that supportive environment for mothers and families in your community. So now I'm going to introduce more formally our guest speaker. Dr. Nicole Kumi is the CEO and founder of The Whole Mom, a maternal wellness organization specializing in perinatal transitional coaching, assisting mothers with preparing their mental health as they transition from pregnancy into the fourth trimester. In 2018, Nicole found herself on the opposite side of the behavioral healthcare system, needing services after being diagnosed with postpartum depression. It was during this time that she realized how little discussion there was around perinatal mood and anxiety disorders, as well as the challenges in finding the right types of services for what she was experiencing. Once she was able to improve her mental and emotional health, she shifted into the maternal mental health space, providing education, support, and information to moms about the mental health aspect of postpartum. The goal was to reduce stigma, raise awareness, and empower mothers to seek help. Nicole's services range from a free educational email course, one-on-one coaching, on-demand courses, and a virtual moms community to meet other mothers who are on their journeys, allowing her to effectively transition into the fourth trimester and redefine herself as a mom. Nicole has written and published 2 books about motherhood and mental health. And so, Dr. Nicole, thank you so much for being here and for being our first speaker of this series, and we look forward to your presentation.
Thank you so much, Roni. I am really happy to be here. Welcome to everybody. I see a lot of friends from Maryland. I am local in the DMV myself. Really excited to be here and be a part of the Healthy New Moms in partnership with Mental Health Association of Maryland. So I know people are coming in with various backgrounds, experience levels. Some people might be parents, you might be providers, providers amongst all, doulas, midwives, psych NPs. Hopefully we have some OBs in the audience today as well. I just ask for you to take that work hat off for a little while so that you can sit back and let somebody give you a little bit of information around a topic that I find to be very sensitive and very important. So to get started, we're just gonna rip the Band-Aid off here and we'll get moving with everything. Just bear with me 1 second to rearrange some topics we have here. So as Roni mentioned, the topic for today, we are going to be talking about postpartum as a period of time and not a diagnosis. And the reason that I think that this is so important and so special is that we use the term postpartum as this umbrella term, and that is what it is, but it's not a diagnosis. And if I asked you to close your eyes or just think for a minute, the amount of times either you have unintentionally or inadvertently said this or heard somebody else refer to a mom as having postpartum, We understand that that is possible, that that is a term that people use, but it's really detrimental to our mom's mental health, and it kind of exacerbates the shame and stigma associated with perinatal mood and anxiety disorders. So I'm sure some of you are coming in here today, obviously, because this is very important to you. And this webinar, I hope, really provides you with some valuable insight, tools, and resources that you can use. We all have to do our part as it relates to maternal mental health, and especially contributing to the decline in the maternal mental health crisis that we're currently facing. So, Roni did a wonderful job introducing me. So, thank you so much. But just a little bit about me. This was not always my space. I came to this space because of lived experience and then decided to increase my education and my training, specializing in the perinatal space. I am a wife. I am a mother to several beautiful children. I do own a business on the side. I am an author, as Roni mentioned. I'm a two-time survivor of perinatal mood and anxiety disorders, 2018, and I had a baby like many others in 2020 when the world was very different. And it contributed a lot. And we're going to talk a little bit about how some of those socioeconomic status and how contributors in the world, especially today, are impacting our moms and their mental health and what you can be doing about this. I am the founder of Perinatal Transitional Coaching, which is really special because it works with moms through pregnancy into the postpartum period and beyond, allowing them to have support and structure at those transitional points in their lives. I happily sit on Postpartum Support International's Maryland chapter board. We are doing some really exciting things. So if you're in Maryland, please get involved. Go over to PSI's site, contact me afterwards. We have a lot of really cool things coming up. But part of that is I am an advocate. I am an advocate for all things mental health, most specifically maternal mental health. Our moms are very special individuals, and we are the powerhouses of our families. So we have to be taken care of. And we also have to make sure, as providers, as friends, as supports to moms and to families, we know what we're talking about so that we are in a position to help moms. I run a podcast called Midnight Mama. I talk about all things from perinatal to perimenopause and the things that are keeping moms up at midnight. I never shy away from any subject. So if anybody's interested, please let me know. And obviously, as you're seeing here today, I am a speaker and an educator in this space because I believe so deeply in this. So let's talk about the term postpartum, right? We hear this said so many times. I hear people say, just the other day, I had somebody reach out and say, I'm really worried about somebody. I feel like they have postpartum. And I'm like, no, this is why we're doing this work. This is why the education is here, because it is not something that we have. So understanding the term postpartum, it is the period after childbirth. There has always been some discussion around that accurate time. Some people believe that it is after 6 weeks. Some people believe that it is forever. I believe that it is forever. And for a lot of moms out there, it does feel that way. You are forever changed. There is a clinical cutoff specifically for diagnostic criteria. But when we're talking about that postpartum period, it's from birth to whenever mom feels like she's in a position to say she doesn't feel like she's struggling with any challenges. Unfortunately, because this term has gained misuse and we're not using it the correct way, we're starting to view the postpartum period as a negative. And I'm seeing that a lot out there. There is a lot of beauty and joy that is happening in that postpartum period. The mother is evolving. She is transitioning from her pregnant self into her motherhood journey, whether it's her first baby, her second baby, her third baby. This is a time of joy for her, which is often overshadowed by some of the challenges she's having. And some of those challenges are because of the things that we are saying, the way that we are showing up, and the miseducation, misinformation that is out there that kind of contributes to the stigma associated to maternal mental health. Any of you that have had your own personal experiences know that there was probably a time in your journey where something didn't feel right, but you didn't speak up about it, or you've treated somebody that has been in that position. And it's typically because there's shame, there's judgment, there's stigma associated with this topic. So the goal today is to really define what the postpartum period looks like. Avoid looking at somebody as a diagnosis. We don't ever want to do that. Somebody has a perinatal mood or anxiety disorder. They are not what this is. So when we think about the term postpartum, like I said, this is really the period of time that we want to focus on, okay? We don't want to be referring to a mom as having postpartum. She's having challenges in the postpartum period. There's power in your language, especially in mental health. We want to find people that have supportive language, especially when we're speaking about our moms. When we think about tying moms to her struggles, like I said, we exacerbate that feeling that the postpartum period is something completely negative. It's obviously always important to choose the words we are using wisely, especially about a mom's sense of identity. The language we use really shapes how she's viewing her experience. We want to look at focusing on empowering terms that recognize both their challenges and the strengths so that we could kind of foster a healthy environment for mom to grow in. We also want to contribute to moms wanting to seek help. When we don't use appropriate language, we can contribute to the inability for her to speak up, speak out, and say, I need help because she's afraid that she's going to receive that stigma. She's going to receive that judgment. So be very careful in the words we use and how we're referring to our moms. And we're going to talk about, what can you do to help? So the use of empowering language, normalizing the experience. I love seeing moms all across social media that are sharing about their journey, the good and the challenging times, right? Because that's really what the normal experience is. And as somebody who went through this as a behavioral health care provider, as somebody with an advanced degree, I felt very ashamed of what I was going through because I felt like I was in the minority of people having this experience. Turns out I wasn't. And I didn't know that because we don't have enough people speaking about this. And what we really want to do is make sure that we are empowering moms to have those conversations by giving them the education and information they need to say something's wrong, and then having the trust in the providers and the people that they are connecting with to provide the appropriate level of care. We really want to look at supporting moms holistically. My organization is the whole mom. We're looking at everything. We're looking at conception, we're looking at pregnancy, we're looking at postpartum, we're looking at birth experience. We're looking at everything that makes up her whole journey. Because as you'll see when we get into some of the diagnostic criteria, there are risk factors, there are protective factors, there are things that we might say, we want to dive a little bit deeper and figure out what is going on here. And we, as supporters or as providers, want to make sure we're in a position to ask the right questions that empower, not further isolate moms. So, one of the most common terms, and I think I heard this referenced maybe once in my own journey, is the baby blues. And this is not a diagnosis. A lot of you might know that. This shouldn't come as a surprise to too many people, but people get confused about this. And I think that this is more of a generational concept. After I had my daughter and she was 3 months old, I remember calling my mom and just saying like, I don't know what I did. This was really hard. I'm not sure if I'm cut out for this, and I'm crying. I'm upset. And she said, you know what? I think you might have the baby blues. This is a really common thing. Now, my mom is in her 70s, so she was raising children in the 80s. Very different supports, very different picture of maternal mental health. Right? That generation, specifically my mom's generation, didn't have what we have now, and that is a platform and a place to have these conversations. So she mentioned maybe this is the baby blues, and I quickly Googled and found, and I'm like, maybe it is. I don't know. What we didn't recognize is that neither one of us knew what we were really talking about. She was just trying to be very helpful in that space. But the period of time is what really matters here. Okay. That is where we want to stay focused. So it refers to a short-term period of emotional ups and downs that many new moms will experience. And it's fairly common and temporary reaction to that hormonal shift and your physical recovery and all of the other things that are happening in the postpartum period. As you can see, it's fairly prevalent. Up to 80% of new moms experience the baby blues and really see the symptoms within the first few days, up to a week, and it should resolve within 2 weeks with proper support, rest, nutrition. You shouldn't see this continue. Now, some people say, well, what might cause this? And that's a lot of different things happening in that postpartum period. Hormonal shifts, sleep deprivation, hello, something we are not fully prepared for, the emotional overwhelm, and whether, again, this is contributing to all mothers, all birthing individuals. Just because a mom is in with her second child or her third child does not mean that she won't have these experiences. Just because we've been through it doesn't mean that it won't not happen to us again. So I want to caution you too when we say things like, this is your second baby, this is your third baby, you should be fine with this. That can come across very invalidating to our moms. So be mindful of that. The emotional overwhelm, again, if this is baby one, this is brand new. If this is baby two, this is the first time she's a mom to a newborn and a toddler or an 11-month-old, have you. And the physical recovery. Everybody's recovery looks different. Vaginal birth, cesarean section, emergency cesarean section, other factors that can contribute to this. And some of the most common symptoms we see here: mood swings, irritability, feeling overwhelmed and anxious, fatigue, trouble concentrating, and some increased sensitivity and sadness, I think, is one of the ones that they see most. How do you help moms cope during this time? Encourage rest, not sleep. Rest. One of the poorest pieces of advice we give our moms is to sleep when the baby sleeps. And if you have ever had a child that doesn't sleep, you know that that is not helpful. So we are focusing on rest. Where can she put her feet up? Where can she just take a break mentally from the things happening in the house? Can she outsource? Can somebody come in to provide some assistance in the home with her? Asking for help, letting, if this is your mom, encourage her to ask the partner, ask community members, ask family members, whoever it is that might be around to help her. Encourage her proper nourishment, talking about it. Validate the experience. You don't have to say, this is your second baby. You shouldn't have. Talk to me about what's going on. What are you experiencing? What are you feeling right now? How can I be helpful to you? Not essentially asking her, tell me what you need, but in a sense, asking the appropriate questions and always encouraging fresh air. Now, again, this can be challenging for those winter babies. I don't know about walking outside in 10-degree weather if that's really going to help me, but I know that sometimes it's just the shift in your environment. So stepping outside, doing something that is healthy and whole for her. When you want to seek help, obviously we're gonna get into the perinatal mood and anxiety disorder diagnoses in the next slide. But if this is lasting longer than 2 weeks, so at that 3-month mark when I was experiencing this, in retrospect, I was starting to enter into postpartum depression and just did not realize it. And that is specific to the time frame. After those 2 weeks, if things have not improved, this is when we want to start looking for help. Increase in persistence in the sadness, any signs of hopelessness, severe anxiety, any panic attacks, and if there's difficulty bonding with the baby, again, we can't assume that moms give birth to a baby and automatically love that child. Research knows, education is out there. That isn't instantaneous for all moms. We have to be very courteous of what mom is experiencing right now and not shaming her or saying or forcing the baby upon her. We want to be really careful in this time period. But that would really be your criteria to seek help because anything over those 2 weeks, we're really starting to delve into our perinatal mood and anxiety disorders, otherwise known as PMADs, PMDs, depending on where you are. This is going to take a little while. We're going to go through some of this, and I want to provide some examples. And the reason that I think that this area is so important, even if I'm not a clinician, I do not do diagnostic criteria, I don't diagnose individuals. I am very aware of the signs and the reported symptoms from moms, and also coming with some lived experience, knowing that I was hiding a lot of these things, at least thinking that I was hiding a lot. There were certain questions that I wish people would have asked me. And I think had they asked me specific questions, I may have been a little more open about what I was experiencing. And again, it's really about creating a safe and supportive environment for moms to feel like they can have these conversations. So if you are not a clinician, that is fine. Again, I'm not in here to have that conversation of this is the DSM criteria. This is a broad overview so that anybody working in this space, even as a mother, a sister, a father, a boyfriend, a support, you have the same information. So we're just going to kind of go through a very baseline here. Obviously, our first two, postpartum depression, postpartum anxiety. This is what people tend to mean when they say, I think she has postpartum. These are our two most common diagnoses, and we're going to kind of review through some of these. So postpartum depression, the prevalence rate is anywhere from 15 to 20% of moms. 1 in 7 moms, and I do want to just say moms and birthing individuals are interchangeable within this discussion today. So a birthing parent, a mother, 1 in 7 experience moderate to severe postpartum depression. There's 30 plus people on here today. You can look around and think 1 in 7 individuals around here. That makes up a good portion of our webinar. The rates can actually increase for any moms with that have additional risk factors, such as financial stress, lack of support, or a history of mental health issues. So for myself, I was at risk with that second baby, coupled by a national pandemic and some isolation during that time, lack of services. But this is a serious mood disorder that occurs after childbirth And you typically see a lot of sadness. There is hopelessness, emotional numbness at times. It affects a mother's ability to care for herself and her baby. Now, this might not be something you see. It doesn't mean that mom is laying around doing nothing and the baby has been unchanged, but there are specific needs that might not be being addressed. Unlike the baby blues that typically resolve within 2 weeks, PPD lasts longer and it often requires some treatment. So, what you might see is a mother reporting feeling overwhelmed and unable to bond with her baby despite really wanting to, sharing with you that, like, I just don't feel connected to my child. I don't feel like I'm doing the right thing. There might be persistent sadness and guilt. There's a lot of guilt that comes with once you bring this baby into the world and you might feel ill-equipped to handle this child, or that you're experiencing sadness when everybody tells you you're supposed to be happy, right? This is an individualized experience from our moms. Moms can have difficulty sleeping even when the baby is sleeping, and she'll struggle with excessive fatigue. This is really important. And again, why I caution people not to use the language of sleep when the baby sleeps. That is outdated and poor advice. Mothers have an inability to do that, especially if they're dealing with any type of perinatal mood or anxiety disorder. Postpartum anxiety is also one of the more prevalent disorders that we see in reportable symptoms between 10 and 17% of new moms. So we're really looking at 1 in 10 moms, with actual some studies suggesting as an upward to 17%. They're often underdiagnosed, but estimated around that place. And this can include generalized anxiety disorder as well. This really looks like excessive worry, fear, and nervousness that interferes with their daily life. So, unlike postpartum depression, the anxiety is marked by a restlessness and a constant feeling of what if? What if something happens to the baby? What if I can't sleep? I know for myself, I had a colicky baby in 2020, and it was like, what if he doesn't stop crying? What if? So, even when I laid down at nighttime and I was exhausted, I was physically exhausted, mentally, I was stimulated. So, that's something to watch out for if the brain is not shutting off, if there is that consistent, I can't do this because what if this happens? What if this happens? There is a fear of something else happening to impact that situation. So it's consuming too. And there can be racing thoughts that come with this. And there might be some physical symptoms that she would have to be reporting to you. You may not be able to see nausea or dizziness or a racing heart. So those are questions that you want to ask. What are you feeling? What are you experiencing right now? Talk to me about what is going on. Postpartum anxiety can be difficult because moms aren't going to open up and share with you what is happening inside their brain. These are the things, this is where you have to dive a little bit deeper. Where the postpartum depression, you might be able to see some of the things going on, the not bonding with her child, not spending time with her child, not keeping up with herself or her house. But the anxiety tends to be something internally manifested that moms are dealing with in a very different way, typically also hiding from their partners in plain sight. Next, we move into panic disorder. And this is anywhere between like around 4 to 10% of women experience frequent panic attacks in the postpartum period. And what you're really looking at here is like symptoms of fear, rapid heartbeat, shortness of breath, and dizziness that almost make moms feel like they're going to have a heart attack. So, the appropriate definition when we're talking about panic disorder is that it's a type of anxiety disorder where they experience a sudden, intense episode of fear, which is your panic, and it seems to come out of nowhere. And then these episodes are often accompanied by some type of a physical symptom, like we said, the racing heart or the nausea or dizziness. So, you think about a mom that is in her postpartum period, she is not sleeping a lot. She's having difficulty. Maybe she doesn't have support in the house. And then she starts to experience panic attacks. And she is now her heart is racing and she's worried. And all of these feelings of this what if are starting to run through her head, these racing thoughts that she cannot stop. She cannot find a way to ground herself during this time. So now she starts to avoid certain situations, such as being alone with her baby. Now there's a fear. What if I have another panic attack while I'm changing his diaper? What if it happens to me while I'm going down the steps? Right? These are often, and we hear them used interchangeably with like the intrusive thoughts of motherhood. What if I fall down the steps holding my baby? What if I get into a car accident? The scary part about this, the panic disorder, is that moms will feel like they're losing control or that they're having a heart attack. And if they don't speak up about this, this could really lead to isolation, which is a risk factor for continued perinatal mood and anxiety disorders. We talk so much about the importance of community and supports in the fourth trimester, in the postpartum period, but moms tend to self-isolate because they are afraid. I cannot take my baby out to Target. I know for me, I just the crying used to really get under my skin. And what if he starts to cry while we're out at the store? I've seen lots of babies cry at the store. I've seen lots of babies cry at a restaurant. That shouldn't be something that prevents me from taking my child out. What if I get into an accident picking them up from daycare in the snowstorm? Maybe I should keep them home from school today. These are real thoughts that I was experiencing that could have potentially led to a panic disorder had we not said, wait a second, let's talk about this. Let's understand what we're experiencing and what is happening here. So we want to be careful here in asking moms, how often are these occurring? What symptoms are you feeling? What are you experiencing during this time? What is it preventing you from being able to do? Because we really want to look at the duration and the intensity and the frequency of all of our diagnoses. Obsessive compulsive disorder, I think that it's really important to talk about this because, again, as we talk about generations, lots of things are not accepted, right? And our generational partners may not understand this, right? Well, this is no, you have a routine. You have a routine that you do. I hear our young people say this an awful lot, right? Oh, I have OCD. They don't. They have a routine or they have a specific way of doing things. They might be superstitious. So understanding what obsessive compulsive disorder looks like in the perinatal period, I think is really helpful for providers, for individuals that are running an organization that might be employing moms or partners, so that you can understand how this can be impacting their mental health and how they're showing up in other spaces. So the intrusive thoughts and compulsive behaviors related to keeping the baby safe, that's really what this is around. We're worried about if I don't do this, then this is going to happen. And this can affect up to 1 in 20 moms. Okay. Now, the other side of this is that many moms with postpartum OCD do not report the symptoms. And that's typically due to the shame or the fear of judgment. So you mean you can't leave your house until you do A, B, C, D, and E? Yeah, that sounds ridiculous. Thank you. That's invalidating, and this is my experience right now. Remember this, no parent goes into pregnancy in the postpartum period wanting to experience any of the symptoms of perinatal mood and anxiety disorders. So again, be careful with the language and the judgment. Make it a safe place for them to have this conversation. So we're really looking at the OCD is the intrusive and unwanted thoughts, right? Like we know that these are not good thoughts. These are not rational thoughts. They're considered the obsession. And then the repetitive behaviors that we're doing, those are the compulsions that the mother feels like she has to perform in order to reduce her anxiety. So, in order for me to safely get my son strapped in the car and be okay driving in the snow, I have to engage in a series of rituals or behaviors that will make me feel at ease getting in that car. And this could be a simple 2-step routine. This could be an 11-step process for some individuals. So think about our moms that are returning to work after our 6 weeks, 9 weeks, 12 weeks, have you, of FMLA that they get with their jobs, and then having to engage in specific routines that can take them 45 minutes to an hour before having to leave their house. So our mom showing up late, our family members being impacted, our partners showing up late because they're home, they're worried about them, and they're trying to see what's going on. So you really want to make sure that we're asking, again, the right questions. A lot of this can also be that moms are having these recurring and distressing thoughts about accidentally harming their baby, even though they don't want to. Like people will say, I know I don't want to do this to my baby, but I'm afraid that when I'm clipping their fingernails, I might cut something else. Or I might do this. I fear when I put the baby down in a different room, they're going to stop breathing. So I need to get up in the middle of the night. This is why, again, saying sleep when the baby sleeps is not helpful because there might be other stuff happening for moms, especially if she's experiencing any type of OCD. Postpartum post-traumatic stress disorder. That is a lot. This is around 9% of our moms will report experiencing this. And this can be related to birth trauma, emergency C-sections, NICU stays, or past trauma. And these can contribute to PTSD in about 9% of our moms. Some things that we might see here is moms experiencing flashbacks of a traumatic delivery. I want to be clear when I speak about a traumatic delivery. I think sometimes people think that the trauma has to be something um, extravagant. And for me, how I identify trauma with the moms I work with is anything that didn't go the way she thought it was going to go. And that could just be you had an induction and it was canceled because somebody went into active labor and you had to go the next day. It can be traumatizing. Again, it's not about what we think is traumatizing, it's about our moms and what they're experiencing. But she can be having nightmares about this. There's hypervigilance, and there might be an avoidance or of reminders of birth. So she may not want to tell you her birth story. She may not want to think about being in the hospital and what it was like. She may not have a lot of pictures of that time. There might be a desire to have no more children. And if she does choose to have children, she may not want to go back to that hospital. She may not want to see that specific physician. This is also loss of a child, significantly traumatic for our parents. There may be a desire to seek support somewhere else, to take a different path this time because they don't want to be reminded of this. Bipolar disorder, although we hear this an awful lot, it's very low range, 1% to 2%. And this is where we're seeing a lot of the mood swings between the extreme highs, which is mania, and the deep lows, which is the depression. And these can obviously be worsened by the hormonal shifts and sleep deprivation during the postpartum period. Many cases of bipolar disorder tend to go undiagnosed before pregnancy. And in my experience, in my education, what I've heard the reason for that is typically because we don't often see the mania as being mania. We see that as being well because we're so focused on seeing the low. And remember, bipolar has to have the two components for that to meet diagnostic criteria. So when a mom is presenting as feeling invincible, or she can take on all these projects and she doesn't need sleep and she's barely eating, and then later falls into some type of a depression, or she's isolating, unable to get out of bed, making poor decisions, financially risky decisions, things like that. Those are really some of the things we want to pay attention to with bipolar disorder. Okay. And then the last one here, which is not talked about enough, in my opinion, and I think because of the low prevalence, it is extremely severe, which is postpartum psychosis. So it's 1 to 2 per 1,000 births is what is the data reported here. But this is a severe mental health emergency, and this can include delusions, hallucinations. There can be mania, paranoia, disorganized thinking, and some of the risk factors associated with this are bipolar disorder and a history of psychosis. This is why we need to know. This requires immediate medical intervention. Unfortunately, postpartum psychosis has a 5% suicide rate and a 4% risk of infanticide if untreated. Asking these questions, understanding what a mom is experiencing. Postpartum psychosis can be exacerbated by sleep deprivation. We know what is happening in that fourth trimester. I was a mother who bordered on postpartum psychosis due to my lack of sleep. I was averaging 2 hours of sleep a night, and I thought I was okay, and I wasn't. And it wasn't until I became very unwell that we realized something had to be done here. And medical intervention, having supports, having trained providers makes all the difference for our mom's experiences. So if a mom is reporting that she's hearing voices telling her that her baby is in danger and that she has to act to save her baby or to save herself, if she feels like she has special powers or she's receiving messages from an outside figure to do certain things, any disorganized speech, any disorganized pattern of thinking or confusion puts her and her baby at risk. And we want to be very, very careful about this and having very appropriate conversations as it relates. So we talk about the disorders and kind of what it is that the criteria that makes up these disorders. But these are some of the symptoms. And again, the symptoms are not things that we will necessarily see. These are things that our moms are experiencing. And they help you ask the right questions. So again, asking moms, how are you managing the postpartum period? How have you been feeling? How has your adjustment into motherhood been for you? Not just, are you sleeping? Does the baby sleep? How's the baby? We want to be talking about mom. And it's really important to take these symptoms into consideration because, as you saw, some of the examples I shared, they can show the onset of certain perinatal mood and anxiety disorders. So, feelings of guilt, shame, hopelessness, moms are not happy to share their experience when it goes against what they anticipated. There can be guilt feelings about not being the perfect mom, especially in the world today where we're looking at social media and all of these comparisons. There will be anger, irritability, and rage at times. There's a big hormonal shift going on for our moms at this point, and they're trying to find a place to ground and center themselves. They can be losing interest in activities that they previously enjoyed, and they might have difficulty bonding with the baby. Again, our babies are not born in that instant. It's just not instant for us to love them immediately. That is not everyone's experience. So might be a little bit more difficult time for moms to bond with their babies. Appetite is changing. You're seeing some crying, some sadness, constant worry, possible racing thoughts. They're scary and unwanted thoughts. And sometimes moms will tell you, I am having these thoughts and I know that they're not okay. I don't think this way about my baby. I don't actually want to hurt my baby. I don't think anything's going to happen to us, but I can't stop having these thoughts. There might be a lack of interest or pleasure in the things they were enjoying. They're reporting dizziness, hot flashes, nausea, and possible thoughts of harming oneself or the baby. And again, these symptoms really represent a range of emotional and physical challenges that can emerge during the postpartum period. So we understand that there is a level of sleep deprivation. There may be changes in appetite due to nursing, feeding schedules, things of that nature. But when we really start to see them shift and we're looking at the intensity, we're looking at the frequency, and we're looking at the duration, this is what we really want to pay attention to. So, as she's experiencing these symptoms, some of the things that you might see are listed here. She might appear to be disheveled and frustrated. I don't know too many moms in the postpartum period that don't appear to be disheveled at some point. You just may not be the individual that is seeing it. And that is why the education piece is so important because we have lots of providers in this room and we may have individuals that are working in daycare centers. And I'll tell you, our daycare friends are the people that see it all and they hear it all. If we have older children in that daycare, they're talking about what mommy and daddy are looking like at home. They're talking about what's going on. They're seeing parents dropping the children off in their most vulnerable state. So having an idea of what is happening. Now, if moms are coming in pajamas, that might be a standard practice for a lot of moms. But if this is something different, if this is a deviation from their typical behavior, we don't use the word normal because then we assume anything else is not typical. So if I typically look okay when I'm dropping my children off, and for the last 6 weeks, I've had one shoe on, I haven't appeared to be like myself, I look like I've been crying or I'm really frustrated, this is a conversation that we might need to have. There can be a lot of frustration when simple changes, what we think are simple to an agenda change, right? So a mom that is entering back into work and we're now changing the schedule. She has thought about everything up into that point of that schedule. What is it going to look like? What time do I have to nurse? Or what time do I have to pump? What time do I have to leave to pick the kids up from? So those little changes can create extreme frustration for moms. And then that looks like her being very stressed out and very tired. If you can imagine in that postpartum period, most of our moms in this country are going back to work anywhere between 6 and 12 weeks after having a child. Major surgery if they're dealing with a cesarean section. That is not enough time. That's an entirely different webinar. But for the sake of this, she's going to be tired. She's going to be stressed out. But is that tired due to the sleep deprivation, or is it due to the fact that she's experiencing postpartum anxiety and has an inability to rationalize her thoughts and sit down and process through what she is going through? Okay. Time management will be affected by this. I was one of those moms that was able to make a decision on the go, and I could do all of this. And after experiencing some anxiety in the postpartum period, I really started to guess myself. And I wasn't the same employee. I wasn't the same wife that I once was. And I had to relearn certain structures. So I needed to focus my time better in specific areas, and I needed to really improve upon my decision-making skills. So we just want to pay attention with this. Also, we just talked about obsessive compulsive disorder and those rituals and routines that moms might be engaging in. Understanding her time management isn't simply because she has children and now she's late. She's dealing with an entirely new set of systems and structures in her house. And she might also appear to be uninterested or not present, preoccupied. Lots of individuals are carrying the weight of home and work and social skills and all of these different things. They may not have an opportunity to present themselves the way that they once did. They may appear to be a bit disinterested. Again, asking those questions will help you understand where they are and how we can move forward. Now, we know that certain things will put our moms at risk. For perinatal mood and anxiety disorders. And I kind of alluded to some of those a little bit earlier. that could actually increase somebody from that 17% with postpartum depression to 40% of individuals if they have personal or family history of depression, anxiety, or postpartum depression. Okay. So the reason that this puts us at risk, obviously, is what did the treatment look like during that time? If she has had generalized anxiety disorder in the past, this may be like a new or heightened anxiety for her in the postpartum period. This is a new period, a new, how do I want to say this? Like a new experience for her. So she needs to develop new coping skills. She needs to look at things very differently than she once has. When we're looking at pregnancy or delivery complications, that obviously heightens anxiety, right? That can contribute to trauma. Like we said, postpartum PTSD. If there's pregnancy or delivery complications, that stays with moms and they take that into the postpartum period, especially having a miscarriage or an infant loss after maybe possibly going through IVF. That increases anxiety. Having a baby in the NICU, that's not something that individuals typically plan for. And that's not something that we talk enough about either, that it is a potential and it is a possibility. There's a lot of shame and a lot of guilt associated with the parents that are dealing with children in the NICU because they feel like they've contributed to this in some way. And that is not always, that's never the reason, but for that outcome. And unfortunately, not giving moms the education and support that they need, and then dealing with all of the symptoms of postpartum hormonal changes, the sleep deprivation, and trying to triage and navigate having a child in the NICU or losing a child in utero or delivering stillbirth can absolutely impact a mom's mental health in significant ways. So, taking all of this into consideration, it's not just the current experience that moms have, it's what has happened leading them up to this point. I talk about fertility challenges. I work with so many individuals that are utilizing IVF and are having a really hard time. And then they get pregnant, and there might be a series of losses before they bring a child earthside. Having compassion, having an understanding. I tend to shy away from asking any mom, how many children do you have? Don't ask that question unless you're ready to hear that answer. Some individuals have experienced an exorbitant amount of losses, and you couldn't imagine what they have worked for in order to get where they are with this baby. There's going to be anxiety once that baby comes earthside and they are dealing with all of the other challenges that might be present at this time. So, understanding how to support them from that perspective, I think, is really helpful. Feeding complications. And it's not just I wanted to nurse and my milk didn't come in. I think sometimes we really devalue the feeding challenges that people are having. Nursing, whether the milk has come in or not, whether a mom has chosen that she doesn't want to nurse and now she's being shamed in the hospital for using a bottle. That's the reality. That's the experience of some of our moms across the country for being shamed for choosing bottle over breast. Any other type of complications, the baby is unable to digest the specific formula or the breast milk and not gaining weight and then having to be hospitalized, right? All of these other things that can be happening. Infant temperament. I told you I had a very colicky newborn in 2020, and that made it hard. There were a lot of times where I wondered, did I make the right choice? Did I, is this something we're going to be able to do? I don't know if I'm going to make it through this. And, 5 years later, he is a happy, healthy, adjusted individual. But that temperament really, really can, play into how I started to feel, what I was experiencing in that postpartum period. Are there medical conditions? Are we looking at thyroid imbalances? They can also mimic postpartum depression and anxiety symptoms. So it's very important to ask, are you on any medications? Are you having any medical complications? There's a reason that we get this history. Sensitivity to hormonal changes, there's a lot happening in the postpartum period, right? Having twins or multiples, can't imagine that would increase anybody's anxiety or stress levels, right? And I'm not too sure how the twin parents sleep, how they do it. I think that they're superheroes in my own personal experience. I cannot imagine it. So I applaud it, but that's also a risk factor for perinatal mood and anxiety disorder. So keep that in mind. Lack of support from family or friends, we saw that during the pandemic a lot. There was so much isolation and there was that lack of support because of the what if? What if my baby gets sick? What if somebody brings COVID into the house? Financial stress or poverty, obviously that happens and things are hard out here right now. Things are very hard right now. So if you know a family that is dealing with financial stress or poverty, Are there, local shelters or organizations that can help out to give them some of the resources that they might need in that postpartum period? Marital or relationship stress, that is definitely going to be impacted by the perinatal period. But if there are already problems leading up to it, this can put you at more risk. Loss of a loved one, sudden loss of a job or a move, being away from the home country. I think that this is something we don't take into consideration enough because in this area, the DMV, larger cities are heavily populated by immigrant families. And the way that other families and other cultures treat moms and families in the postpartum period can be very beautiful outside of the American culture. And if you're not well versed in it, I suggest talking to somebody about what they do. But there is a very different picture of how mom should be cared for in different cultures. From wrapping your arms around her, wrapping her body, steaming her lady parts, doing all of the things that feel really good for moms. And then you're in this country where 6 weeks after you deliver, you're expected to go back to work and figure it out. Talk about a culture shock. So paying attention to your individuals that you're working with. And perfectionism, unrealistic expectations of motherhood. We all have it out there that it's going to go like this. This is how it's going to happen. This is what we're going to experience. And when that changes, that's very hard for people to accept, and this can put you at risk. So, just a couple of statistics I think that's really helpful here to understand is that 1 in 7 moms, we talked about this, can experience serious depression or anxiety during pregnancy or postpartum. This is why we call it perinatal. The anxiety and the depression can happen during pregnancy. And if it is happening during pregnancy, it puts them at greater risk for it continuing in the postpartum period. 1 in 10 fathers experience depression before or after the birth of the child. Now, I know some people read this and think, well, how is that possible? They're not experiencing these hormonal shifts. Right. But what else are they experiencing during this time? Right. There's increased stress and pressure for them. There's a lack of societal support for dads, right? I don't know too many dads that go down to the barber shop and say, hey, I'm really struggling postpartum and are met with open arms. But we have to change that too. And we have to encourage our guys to go out there and have conversations and be mentors for others that are dealing with this. There can be increased anger for the dads. They're feeling disconnected from the partner, that maybe the partner is fully focused on taking care of the baby or the other kids at this time. This can also lead to an increase in substance use for our partners. So we want to keep that in mind too, especially if there's any family history of this. So, and again, like I said, 1 in 2 mothers out of 1,000 may have a serious condition called postpartum psychosis. We just want to keep those numbers in our head. So, who is impacted by maternal mental health? Everybody. The primary focus is often on the mom or the birthing parent, rightfully so, because they're at most risk for developing PMADs. However, maternal mental health does not exist in isolation. It has a ripple effect, including partners, children, extended family, childcare providers, and even workplace communities. So when you're thinking about this, the baby is impacted by this. There could be a risk of developmental delays, disrupted attachment, and long-term emotional and behavioral impacts if these mental health conditions are left untreated. Treating these is possible, okay? Partners, again, dads, non-birthing parents, spouses, co-parents. We talked about 1 in 10 dads. There's financial stress. There's all the other stresses that are happening in the family right now. Older children, I told you they will go to daycare and they will talk. Mommy isn't well. Mommy hasn't gotten out of bed lately. Daddy's doing all of the cooking. They will tell lots of stories, and daycare providers will either receive that information and have a conversation or leave it be. And our goal is that they have the conversation with us. Grandparents and extended families, they're often taking an emotional toll. They're watching their daughter or their daughter-in-law or loved ones really struggle, and this can create feelings of helplessness or hopelessness. Sometimes these family members take on the role of a parent at times. Maybe the children are being raised by the grandparent right now while mom and dad are navigating the postpartum period. We talked about, the daycare providers, but you're thinking also about your workplace communities. What's happening at work? What other areas are being impacted by mom's mental health? And paying attention to how those individuals can help. So just a fun little graphic here for you. And obviously, this is not beautifully broken out in any specific way, shape, or form. At any point, this could be an 80-20, nothing else. But you're looking at physical impact, physical health, home, work, social lives, and relationships. Those are the big areas that we really want to pay attention to and the questions that we want to ask our moms. So, just a few myths as we're kind of coming to the end here. I think we hear a lot of times, we know about the stigma and we understand why moms don't speak up. And a lot of this has to do with the fact that people say that recovery from a postpartum illness is impossible. And if you have felt this way about your baby, you will never have a bond with your baby. And we think about, when we hear moms struggling in the postpartum period, that they want to hurt themselves or the baby. That is not true, right? And when we talk about recovery, it is absolutely possible as long as there's early intervention. We know that the sooner we identify what's happening, the sooner moms can get help, and recovery is 100% possible for her. Moms are not often in a position where they want to hurt themselves or the baby. It's quite the opposite. They're afraid of doing that, but they're afraid of speaking up for fear of that judgment. And any mental health challenge can have an impact on your close relationships. So I'm here to tell you that I didn't think I was going to bond with my child during that colicky phase in a pandemic. And I can't get rid of him now. He is 4 years old and he is attached to my hip, and we have a beautiful bond. So kind of, dissembling some of these myths that are out there and validating moms experiencing what they're experiencing and letting them know I am here to help. So how do you help, right? What are we doing here? It's very important to have support from family and friends, encourage people coming together, providing meal trains, supports and services, helping with the other children. Is there a way that we can increase mom's self-care? Encourage her to take better care of herself. And this isn't by taking a shower and putting her makeup on. Those are ADLs. We want to increase her self-care. What other things is she doing to pour into herself? Is she going to the movies, spending time with friends? Cooking? What is it that she finds joy in? And focus on her getting adequate sleep. Can you come over and take the baby for a little while? Can you come over and do a couple chores so that she can rest when the baby rests and not have to take on all of these other things in her home? Eating a healthy diet, getting some exercise in. Again, it doesn't have to be CrossFit training. It can be a walk, it can be meditation or yoga, something that she finds joy in. Don't encourage her to train for a 5K if that's not her thing. We're focusing on her needs. Encouraging time with her spouse or partner or supportive friends in her close community. And any type of spiritual practice or support is really important, especially if you know that this is something that is important for moms. So I think it's really important that we look at the importance of the holistic support, right? Supporting moms from physically, emotionally, socially, and spiritual well-being. Anybody that knows me and the work I do knows how special it is to work with moms in this capacity and to understand that maternal mental health is the responsibility of all of us. Our moms are the nucleus of the American family system. And if she is not well, if she is not healthy and whole, anybody that is plugging into her at the end of the day is not going to get fully charged. So we have to prioritize her health and her well-being, asking the questions, finding the resources, putting things in position for her to be successful. And with that being said, I want to just share a little bit about a program that I offer through the Whole Mom, which is called the Fourth Trimester Program. And this is really a safe and supportive community for moms that they can join for 3 months. And these are the modules that we cover kind of on a rotating basis. So moms can join at week 2, they can join at week 6. It's a nonlinear model that just provides mom education, information, support, and resources on the aspects of postpartum, the postpartum period that nobody's talking to them about. We can't continue to expect our moms to navigate the postpartum period on their own. We are not designed to do that. We are designed to have community, to have supports. And if it takes a village to help raise the baby, it also takes a village to help raise the mom and help her transition into her role and feeling safe and whole. So if this is something that is of value to you or you would like to share with anybody that you're working with, I suggest you do so. We'll have a link for all of that as well. But just being able to share resources with moms is really beneficial and really helpful here. And here's just a little bit of contact information for me. Again, you can find me anywhere at thewholemom.com. My email is there if you have any questions about this webinar specifically or just want to connect, just to say hi. I love opening up the pool of providers that I know so that any moms that might come to me for services that I'm not equipped to handle, I have a place where I can connect them and kind of offer a continuum of care. The podcast is there. And then the last one is the free email course that is really helpful for moms that are navigating this time during pregnancy or the postpartum period. But I'm really happy, thankful to have been here today and been able to provide some of this information and oversight. And I hope you find as much value in it that I did in creating this. And I'm happy to take any questions in the next 4 minutes, Roni, if that's something that you want to do or however you want to proceed.
Absolutely. Thank you so much, Nicole. This was such a powerful presentation. And we do have a couple more moments. So if anyone does have any questions, feel free to either drop it in the chat and we can share that for you, or you can go ahead and unmute and share. Yes, Shanice, the slides will be made available and the recording after this. So someone asked in the chat, what's the clinical cutoff time period for diagnosing postpartum depression?
What I have seen was anywhere between 12 and 36 months. I think that it's probably around the 12-month period because after that they would meet criteria for just generalized anxiety or major depressive disorder, not specific to the perinatal period.
Thank you so much.
Sure.
We'll wait to see if there's a couple more questions. Someone asked, thank you so much, Nicole. What are you seeing in terms of trends with especially Black moms in the postpartum phase?
That's an excellent question. The trends that I'm seeing is not enough services applicable to her specific experience. And I see Black moms being more at risk for perinatal mood and anxiety disorders because of a lack of services, a lack of educational value given to them. And people aren't taking Black moms seriously when they're going in and they're saying that this is their experience. So we're seeing a lot more isolation, um, and really moms looking for people that look like them or are culturally aware to provide the services. So I know at least through Postpartum Support International, we have been had a high focus on really diversifying the providers that are trained in perinatal mental health so that our moms in specific communities can find those resources and that they are made available to them across the board.
Yeah, so true, so true.
Yeah.
And someone says, how can we offer support to people in more rural areas and that don't have access to any or many therapists?
Yes, I think looking at a place such as Postpartum Support International that has so many free resources, they have at least 50 online support groups and they're free. And they have them for minority women, they have them Spanish speaking, they have dads, they have same-sex partner groups. I mean, you name it, they have it. And they are probably the largest provider of free resources. I always tell people start there. And then if you need more individualized support, looking at your county, looking at sponsorships, reach out to me. I can help you find somebody in your location that can meet your needs. I think a lot of providers now, such as myself and other coaches and doulas, are operating on a sliding scale model and offering discounts to veterans and minority populations as well.
Yeah, thank you so much. And someone also mentioned that a lot of therapists offer telehealth as well. So that is also the case too. So we do have a couple more moments just to close out for our session today. I do see a couple more questions. We will share Dr. Nicole Cumi's email and the Postpartum Support International website as well. So I just want to thank you, Nicole, for just a powerful presentation. I want to extend a special thank you to all of you guys for joining us for our first series in this webinar series for Healthy New Moms. If you are interested in serving as a guest speaker for upcoming Healthy New Mom webinars, feel free to email info.hnm@mhamd.org and share what your potential topic might be, and someone will reach out to you from there. And we look forward to working with all of you to continue bringing education and resources to communities and moms across Maryland. If you have any questions, feel free to reach out via that email address. And that is all for today. Thank you again, Dr. Nicole.
Thank you very much. Take care, everyone.